My name is Ariel Kramer, and I'm joining you today on behalf of the Digital Health Hub Foundation. The Digital Health Hub Foundation is a digital health accelerator at the Worldwide Center for Healthcare Innovation. Our largest program is our awards program, which seeks to find the next best, most impactful, and disruptive in 13 categories. We had over 1,500 companies apply this year, and 350 were named quarterfinalists, and now we are down to 124 finalist companies. Today, I would like to introduce you to Matthew Holt. He's our executive producer at the Digital Health Hub Foundation and the founder of Healthcare Blog and Health 2.0. So Matthew, I'll let you take it away.
All right, fantastic. Thanks, Ariel, and thanks for all the great work you've been doing helping publicize this. So the way this works is we go around really quickly. We have on camera the rising stars. We actually have 5 of the rising stars, and the 5 out of 8 we're missing 3, and then in a little bit we'll shift over and do the best in class. So the division is between the sort of the earlier stage companies and the slightly later stage companies. We're going to dive into that. Everyone will get a chance to introduce their company very briefly, do their elevator pitch, answer a couple of questions from me about till have a bit of a chat, and then we'll switch over halfway through. But before all of that, we get a word from our buds at McKinsey, who have discovered digital health after a while. I tease, but I noticed they started their digital health conference the year that Health 2.0 stopped doing digital health conferences. So I don't know what that tells you about the market. And from McKinsey, we have Oleg Bestany, to introduce this. Oleg, take it away.
Thank you so much, Matt. And the name is Oleg Bestany, a partner with McKinsey focusing on telehealth. You may know us as strategy consultants, but what you don't know potentially is that why we're here. We serve startups, scale-ups. We actually have served thousands so far, including 450 unicorns globally. And we don't stop at strategy. We partner as long as 2-year partnerships from strategy to launch to execution to jointly develop and build startup businesses. So super excited to be here today. What you see here is we have found it to be very true to digital health startups to use our 10 timeless tests of strategy. And as you are all thinking about the discussion today, think about, we would ask you to focus on the 6 and answer questions such as, how will your strategy beat the market? How does the strategy tap into a true source of advantage? And is it granular enough about where to compete? And as you go through this, would be exciting to hear that dialogue, and best of luck to all of the CEOs and company representatives. And onwards. Matt, back over to you.
Thank you so much, Oleg. That's great. And yeah, always good. I as a consultant myself, I always tease, right? Because, you know, we'll tell you much stuff. Sounds obvious, but there are plenty of people who don't pay attention to these.
That's right.
Things and a lot more basic stuff. So always good to do that. All right. So if you stop sharing, we will then go and put everyone's face on the screen. And what we're going to do is to go round the companies. They're going to introduce themselves very briefly, and then we're going to hear. Then we'll get into some Q&A. But we have 5 of our 8 rising stars. So we will start with Sebastian at Scene.
Thank you very much, Matthew. Sebastian Seiguer. I'm the CEO of Scene Health. We were formerly named Emoca Health, so many of you may know us by that name. Spun out of Johns Hopkins in 2014, and we've created a video-based technology as well as a virtual care team to help people take their medication properly at every dose. Patients with asthma, diabetes, hypertension, sickle cell disease, those with opioid use disorder, many other conditions as well, and validated that in now 21 peer-reviewed publications showing that we take adherence from, you know, in the chronic condition, somewhere about 50% up into the 90s on an observed dose-by-dose basis. Thanks for having us.
And Sebastian, tell us quickly, what's the actual consumer experience?
Patients or members of a health plan, depending, have a mobile application where they open it up, video record themselves telling us how they feel, how they're doing, take their medication. On the other end, our care team of pharmacists, nurses, and health coaches respond with a video right back to them to continue the conversation and help them out.
So it's asynchronous next-gen telehealth, and bizarrely, it works. when I heard about Imoca, I thought,
Yeah.
what the hell are these people doing? But it's amazing.
Yeah. Yeah. That's the amazing thing is that it actually does work. And that's because we modeled this on a process that's been around for about 4 decades called directly observed therapy, which is when a person has a meeting with another person to make sure that they take their medication and do it properly. Incredibly, we changed the standard of care this year. So as of March, the CDC has recommended asynchronous video directly observed therapy for certain infectious conditions as equivalent to an in-person visit. So it's really the first time in all digital health that you have an asynchronous video visit being considered the same as an in-person visit.
So I won't ask you about why it's next-gen technology and ask everyone else because you told me. Ryan, IncludeHealth.
Yeah, hi everybody. I'm Ryan Eder, founder and CEO of IncludeHealth. Very similar kind of narrative here as we're focused on asynchronous care delivery. Specifically, we digitize physical therapy through computer vision. And so, you know, if anyone's had physical therapy, you've dealt with the logistical and economic challenges of accessing it. So our platform is entirely web-based, where we are able to send digital plans to patients on their own devices. It runs on phones, laptops, tablets. There's no downloads, passwords, or sensors involved, and so they're able to take care of their care on their own time, in their own home, and all that data is sent back to PTs to review and progress them accordingly.
Fantastic, great thing, and you know, those of us who are getting old need PT. It's a great service. Sheela from Neuroglee.
Good morning. Thank you. I'm Dr. Sheela Myers. I'm the Chief Medical Officer at Neuroglee and a practicing neurologist. Neuroglee is a virtual specialty provider who uses technology to power at-home access to evidence-based, non-pharmacologic, multi-domain care for patients and their caregivers with cognitive disorders like mild cognitive impairment and dementia. We become the trusted extension of our healthcare partners through both telehealth visits and a patient-facing and caregiver-facing app that allows for content and assessments to be delivered in home through our partnership with the Mayo Clinic's in-person habit program. So we use our platform to provide dynamic insights to the care team to accelerate and personalize clinical decision-making, as well as coordination of care. And our care model improves not only timely access to neurology specialty care, but ease of access at home for patients who may struggle with independence, cohesive access to expert at-home cognitive care, and shared access to the supportive care resources needed for the patient and family or care partners that serve them. We're excited that our first clinical trial successfully demonstrated improvements in immediate and delayed memory, as well as reduction in depression and anxiety, as well as caregiver distress.
Fantastic. Yes, and looping the caregiver for that group of patients is obviously incredibly important. Judith from Nest.
Hello, everybody. Nice to be here. My name is Judith Nowlin, and I'm the CEO at Nest Collaborative, where we are saving the lives of 2 generations by changing the paradigm of breastfeeding support via telehealth. Simply put, what that means is that we are telehealth for lactation support breastfeeding families. We're uniquely focused on moving breastfeeding support from what it historically has been, which is acute problem-based care, kind of a one and done visit, live and in person, oftentimes within the first 24 hours after a family leaves, before the family leaves the hospital. And we're changing that now to a preventative model of care, where essentially families can get the support they need throughout their entire breastfeeding journey. And that's uniquely enabled by telehealth, meeting families in the home right where they're at, which is a very special use case, since we've got moms with brand new babies who are not really well equipped to be packing everything up and getting out to appointments.
Fantastic. And I know you have a couple of competitors in that space, and it's really interesting to see that you know, people have identified such a niche problem, but obviously one that happens. Kids get born every day, I understand, you know. Keep us on happening. Puneet from CareBridge, and you guys are sneaking in the rising star class, but I don't think you'll be around for it next year, given what year. But tell us about it.
Good morning, Puneet Singh from CareBridge. We're the largest Medicaid value-based care company in the country. We've focused on the home and community-based population, members who are part of the LTSS waiver. We manage their medical and their non-medical spend, and we serve 100,000 patients across the country. What differentiates us is great outcomes. So we've seen reductions in inpatient and ER utilization of over 20% while improving quality. but specifically designed for a Medicaid population and designed for patients who are typically homebound.
Yeah, and you didn't boast, Puneet, but you should have done. You guys just got made #1 in the Inc. 5,000 or 500, whatever the number is, right? For fast growing company, or was that #1 healthcare company? Either way, you seem to be on a bit of a rocket ship ride.
You're very kind. We were awarded the fastest growing company in the country by Inc. 5,000. But I think it's really a reflection of we're very focused on quality of care for members. And I think we're serving a population that is very underserved and others are not serving today. So we've been fortunate that our outcomes have driven our growth.
Right. So that's great. So 5 really exciting companies, all of you serving very different markets and very different purposes. So super exciting to see this. So I'm gonna be the old man here because I am an old man, and B, I've been doing this for a while. So 2008. American World debuted at Health 2.0. It's 2023. There's not much that's the same between 2008 and 2023, but sort of telehealth, even with the pandemic, is kind of what it was then for the mainstream, right? Most people think of it as like an online doctor visit for, you need to get a med for whatever, and it's sort of one and done. And I won't ask Sebastian this because he kind of told us, but for the rest of you, what have you done? What is sort of different and ongoing that is not just transferring a physical visit to an offline to a live video visit? What else is going on in your process that makes this next generation and is really sort of transformative and scalable rather than just, well, you were a mental health therapy company that ran a therapist because the therapists weren't there in real life and they're not there for telehealth either. So I'll start with you, Ryan.
Sure. I mean, Sebastian kind of hit on it. Like for us, it's about delivering efficient and effective asynchronous care. So, telemedicine was always still tied of syncing the schedules of 2 people, right? And so that has its limitations to scalability. So in our world, we use computer vision. So when they're doing their physical therapy, they're getting real-time feedback on counting their reps, logging their range of motion, real-time movement correction. That enables us to let them do it at their own time and then be able to send the data back and be just as effective.
Fantastic. Sheela, same question. And you obviously are dealing with a group as well who, probably have tough time using the telehealth therapy. So tell us a bit about that.
Absolutely. So that's one of the key elements of our product where the telehealth comes in for the patient, is that it has been designed uniquely with the patient with cognitive impairment in mind. So all of the tools that they use to access telehealth, as well as the content for cognitive therapies, are built in there with their design. But that important point you mentioned is that the caregiver is taken into account as well. They have a different portal to access a caregiver app, which supports them with resources, as well as the ability to, at an arm's length, view the progress and instructions given to the patient, their adherence to the program, as well as the ability to join the visits from a different location. One of the biggest challenges I often have seen in practice, and we continue to experience, is patients who don't have the cognitive substrate to make it to the doctor's office at the right time, right place, or with the information they need to make a clear care plan, but also to get a loved one to be able to take time off from work to be able to participate. So the ability to do pieces both asynchronously as well as synchronously with clearly curated and crafted components that are designed for someone with cognitive impairment are really that secret sauce that allow us to have true integrity of understanding of the patient's condition and be able to create that really ideal personalized care plan.
Fantastic. Judith, same idea. What's different about this? I mean, it sounds like you could just put a lactation consultant on a video and be done. What else can you do?
Uniquely in the lactation space, when it's in person, if anybody's been there, done that, and you've had a baby and you've got the lactation consultant at your bedside, oftentimes that lactation consultant will come hands-on and actually manipulate both the baby and the mother to get the right latch. And what happens in telehealth that's really, really unique for us is we have to be entirely hands-off, which means that families, mothers, demonstrate self-efficacy. They learn that muscle memory because they have to do it themselves. The lactation consultant has to guide and instruct in the mother's unique setting in that chair that she'll be feeding in possibly up to 12 times per day, which is really different than the hospital bed or the chair in the clinic. So it's that self-efficacy that is, it's a total 180 from how it's been done when it's in person.
And how do you get that to happen? What's the secret trick, and what are the results compared to the in-person in the hospital bed or wherever?
Yeah, so our care is synchronous. So we are in a live video visit, and it starts with our lactation consultants watching, right? They're watching, they're observing every fine detail of the mom-baby pair. And then they're giving that very precise verbal instruction. Move the baby's belly just like this. Tilt the baby's head like that. Move your elbow a little bit like this. And sometimes those literally centimeters of movement will make all the change in the world. And because mom did it herself, now she's got that muscle memory, and she can then go and repeat it day after day after day with to great success.
How many visits on average does it take to make success?
Oh, that's different for everybody. It's different for everybody.
That's why I asked the average question.
Yeah. So on average, it's about 2 to 3 visits that we're seeing where moms, it usually clicks. And that's something so unique about our services is that historically it's been just 1 visit, and you hope that moms learn everything they ever needed to know about the entire breastfeeding journey, which can last up to a year or beyond within just 1 visit, which doesn't totally make sense.
You seem to have missed that video on YouTube of the 8-year-old still breastfeeding, which I've seen. Go Google it; it's quite frightening. So the 8-year job, hopefully not the 8-year journey. Puneet, same issue. You're dealing with very complex, very sick patients and their caregivers. Tell us a bit about the different flavors of what you're doing there.
Yeah, so of course, a big part of what we do is medical care. So full spectrum medical support, behavioral support, coordinating with the PCP and specialists. That's a big part of what we do. But Matt, as you mentioned, the population is very vulnerable. And so there's a medical component. There's a big non-medical component as well. So we help on things like empowering alternatives, durable medical equipment. So to use a very simple example, if a member says, I want to be more independent and I want to be able to shower by myself or bathe myself, we might help with the shower grab bar or other DME to help that member become more independent. The other piece that's important is in Medicaid, obviously there's a lot of regulatory requirements, and we're able to meet that. So just as one simple example, as part of the 21st Century Cures Act, there's electronic visit verification. Our technology is able to verify when a caregiver comes in the home and help certify that body of work. So there's a medical body of work, and that's interdisciplinary and comprehensive, non-medical work, and of course, helping support some of the regulatory requirements for Medicaid members.
All right, and we have 5 minutes left. I'm going to go around the reverse order and ask, and it's kind of very obvious for you, Puneet, but the business question. You know this well because you guys have got the award for doing so well on that stage. Who's paying, and how does it fit into the rest of the typical healthcare system? So, I mean, is this in general for everyone? Is this a cash payment that's not very connected to the rest of the healthcare system, or how does this work with everyone else's, with the regular doctors and hospitals that these patients are using, and where's the money going to come from to grow the companies? Puneet, this should be a short answer for you, given what you told us earlier.
Totally. So we partner with principally managed Medicaid plans and to some extent Medicare plans. They then contract with us. We manage those populations. As I mentioned, we take full cost of care risk on this book of business, and it's free for the member. So we're not charging the member more. It's not cash pay. We fit right into the healthcare ecosystem. And really, the way we're rewarded is by improving quality of care, and by improving outcomes, we can then reduce unnecessary costs. That's better for the patient, better for the plan, and better for us as well.
Yeah, for a group that hasn't been treated particularly well in the past, to be clear as well.
That's right.
Judith, same question, probably different answer.
Yeah, well, we work with insurance companies and bill fee for service. So as long as families are in network, they're actually coming under the ACA mandate and receiving our services with no out-of-pocket costs, no cost share for the families, which is really, really incredible. We also have relationships with employers and employers saying we understand the benefits and the benefit to our working mothers who have the breastfeeding support and what that means for their organizations. And then we even have value-based contracts as well, which I see as the future, but we've got a ways to go to get there.
It's the future which will come eventually after we're all dead. Yeah. How many, and Judith, how many patients have been through your, how many mums have been through your system?
Oh man, we've got over 20,000 moms who've been
Fantastic.
through. Yeah.
Brilliant. Sheela, same question for you. Where do you fit into that whole sort of financing, getting paid, making a business out of it?
Absolutely. So given the nature of the patient population we serve, we have a highly Medicare eligible population, just given the age that's most prevalent in dementia. And so at this time, in the early stages of our company, we fit very much into Medicare eligible services, but we applaud CMS with their recent announcement of the GUIDE program, which is recognizing the importance of organizations and participants in providing at-home community-centered care and the complexity of care for patients with dementia. And so as we lean into participating in that space, it really aligns well with not only the needs of the patient, but our economy driving us towards value-based care. So as a highly Medicare eligible population, we continue to align with, thankfully, what they're regarding as best care for these patients to keep them independent, keep them safe, and to reduce the burden both on communities and caregivers in delivering these resources.
And do you do a lot of work with Medicare Advantage plans as well? Or is it all mostly the fee-for-service side?
We do. Just based on the nature of our population, over 50% is Medicare, original Medicare fee for service, and then the next largest slice is Medicare Advantage.
And how many patients have been through your system so far?
So since we switched to our more comprehensive care model, we've had 100 patients that are enrolled and sustained on the platform, and look forward to partnerships now as we transition more across 3 new states where we've expanded.
Fantastic. So you're really, really getting in there. Ryan, same question for you. I had PT, I had a special physiotherapist come to my house the other day. It wasn't very high tech, but it was nice and into their center. But you're not doing quite that. So who's paying and how are you getting paid?
Yeah, we're a bit of a tri-blend. So in a fee-for-service world, we're working with health systems, ortho practices, PT networks for remote therapeutic monitoring. We're also involved in value-based contracts where we're directly treating these patients ourselves. And then also we have patients self-paying on monthly subscriptions accessing our care.
Brilliant. I think I still owe my PT a bill that I never paid, but don't tell anybody. And Sebastian, finally, who's compliance is a big deal. A lot of people are interested in this. So how do you fit in? How do you get paid?
Yeah, Medicaid and Medicare managed care organizations pay us as a contracted vendor, but they assign the spend to their medical spend. The public health departments, we serve about 700 of them. They pay us just software as a service because they use our platform. Life sciences, we do have life sciences customers, drug development. They're paying us on a per observed dose basis. So we have an incentive to make sure people take their medication at every dose.
Fantastic. No, I think that's great. So there we have. Thanks to all of that. 5 great companies out of the 8. There are 3 others who are not here. I won't. They weren't able to show them, but that is we're missing Moto, Sana, and TeleVU Innovation. They were all. For those of you judging, there is information about them, so don't forget about them because they couldn't make this one. But that is the rising star class of Next Generation Telehealth. 3 of the 8 of you will be awarded rising stars. You get 3 prizes, so 3 out of 8, so a pretty good chance. And we'll see you all on the moon stage, as it says behind me, at there, yeah, not at 5 o'clock on October the 9th. Fantastic. All right. Brilliant. We'll look forward to seeing you all. Everyone has to all of you can switch your cameras off. If we can have the folks from the best in class switch their cameras on. All right. Oh, I think we lost one. I'm sorry about that. Robin, can you switch your camera on? We'll wake her up. There she is. Fantastic. And I think we have lost Tamir from TytoCare, so I can do a little bit of spiel about that. Probably didn't know this went on a bit longer than they thought. But let's go dive into the best in class. So same thing for the best in class companies. Now, for the judges, these folks are a little bit more established. As I said, I think the folks at CareBridge were really riding the line there. They were probably rising stars when they when they applied, and by now with some of the growth they've had, and you know, and the number of patients they've through, I think they might probably kick him in the best in class category. But the reason these two different classes were developed, the first couple of years this was done, you had, you know, public companies competing with people who really just had were just getting going, and it was kind of unfair. So we said, all right, time to slice it up, because there are divisions within digital health, even though, you know, the companies we're talking with here are, you know, not yet public and serving millions of members, but certainly have been around longer and raised quite a bit more money. Same thing for the three of you. I'm sorry, we lost Tamir from TytoCare. To start off and tell us about the company, what you do and what the product is, in about 45 seconds. So I'll start with you, Sam, at Oshi.
All right, great. Thank you. I'm Sam Holliday, co-founder and CEO at Oshi Health. We are a digital clinic and center of excellence that diagnoses and treats all digestive and gastrointestinal conditions. Our multidisciplinary GI specialized care team includes dietary interventions and gut-brain psychology interventions, things like cognitive behavioral, gut-directed hypnotherapy, along with medication to treat these conditions. We're able to meet the member every 2 to 3 weeks. It requires a lot of iteration to get at what are really the root causes of the symptoms someone's experiencing, and which treatments in which combination will actually help them keep those symptoms down and controlled, along with providing disease education so that they really understand what's going on as they move forward living with the condition. We're accountable to this outcome of symptom control, because when someone's symptoms are controlled, it unlocks significant improvements in their quality of life and their workplace productivity. And we're accountable to the outcome for our health plan and employer customers in terms of improving speed to access to this care and achieving symptom control, because it reduces downstream escalations in symptoms that cause a lot of high cost use of care. We've proven this in a clinical trial that we ran with a national health plan that showed 92% of our members got to that outcome of symptom control with a 99% satisfaction rate with our care. And importantly, we measured cost savings and showed over $10,000 per member reduction in total cost of care over just 6 months. So there's an immediate impact and ROI to this. And we've helped get this care covered now based on those clinical trial results as an in-network benefit with national and regional health plans. And we work with employers to build awareness among their employees that they have access to this care now.
Fantastic. And very interesting if you go back in the history of Oshi as a pivot from a sort of consumer app to a full service clinic, and you'll see that reflected around the rest of the conversation we're going to have, and we'll talk more about that as a sort of innovation, how telehealth's going in the next little bit. Next, Ryan from Vori Health.
Thanks for having me. I'm Ryan Grant, founder and CEO of Vori Health, neurosurgeon by background. Similar to Sam, we are a nationwide medical practice focused on musculoskeletal care. We're a multi-specialty practice, really focused on the non-operative arm. What we're really going after is a holistic care model where we employ physicians on the non-operative orthopedic side, physical therapists, health coaches, to really have a holistic care model, given that the average health system in the United States does about 50% unnecessary spine surgery and about 20 to 35% unnecessary knee surgery. So trying to combat the unnecessary surgical rate, drive up outcomes. Net Promoter Score is in the 88 range. We have an average reduction of pain about 62%, an average reduction of anxiety, depression is measured on PHQ-2 or GAD-2 of 61%, 70% improvement in functional on the Promise 10 for functional improvement, and up to a 4-to-1 ROI, mixing synchronous and asynchronous care. We also have computer vision motion tracking on the physical therapy side. And then we also give our members access to a hybrid in-person network, because we believe that virtual can only go so far, and it's really about meeting people where they are.
Fantastic, Ryan. And the patient experience, if I show up, if I find Vori, am I starting with telehealth and then going to the in-person hybrid? Am I referred there from the in-person? Do I get to the physical therapy first, or do I do the consult with the specialist first? What is it?
That's a great question. Our workhorses were a virtual front door, so patients come either through their health plan, self-insured employer, or a referral from a primary care provider. On their first visit, they will meet with a non-operative board-certified orthopedic physician and a physical therapist. They'll get a medical diagnosis from the physician. They'll get a functional diagnosis from the physical therapist. And then it really goes into a holistic care model of Nancy coming in with 10 out of 10 back pain. What you find that's most important to her is walking her kid Tommy to school. Her care plan will be literally walking Tommy to school while you're also getting her back pain improved. We can pull in registered dietitians if there's a nutritional component or a weight component driving the musculoskeletal pain. And then people also get pulled into a biopsychosocial spiritual model as you get people better. Most people will get better just there. From there, they can also have access to an in-person network depending on what's going on. And then to your other question, sometimes people do start from an in-person arm and then will come up into the virtual arm. So we really believe in true hybrid care. It's just care. So sort of mixing those two modalities.
Fantastic. Robin, holistic care has been really at the center of what you've been doing for a long time. Full disclosure for those watching, Robin and I used to work together. The height of her career was 10 years ago, and not clearly, no, I've been circling the drain since, but Robin has gone to great heights. Robin, tell us about Parsley.
Yeah. Hi, everyone. Nice to see you today. So Parsley Health is a nationwide digital and virtual clinic specializing in complex chronic patients. As it turns out, chronic disease drives 90% of our healthcare costs, and 30% of our workforce has 2 or more comorbidities. Parsley treats patients across gastrointestinal, autoimmune, cardiometabolic, behavioral health, and reproductive health and hormone conditions through specialized medical programs that are doctor-led. All of our patients work with a dedicated care team. That's our team and our network, which is a doctor, a health coach, and an RN, all of whom go through our in-house proprietary fellowship in something called root cause medicine. And everything we do is based on root cause medicine, finding and treating the root cause. We have a proprietary health risk assessment that looks at a deeper clinical history going back to childhood, very in-depth analysis of social determinants of health, what you're eating, how you're moving, how you manage stress, your relationships, do you have meaning and purpose in your life? And we do smart diagnostic testing. So we connect the dots across the body from what's happening in your gut could be driving your brain fog, and vice versa. And so we do that diagnostic testing, and that data set enables us to prescribe a truly root cause patient care plan, which includes nutrition and food as medicine, mindfulness-based stress reduction, and mental and behavioral health practices, movement, sleep, evidence-based supplements, and of course, prescription drugs and referrals. And this care model for patients with, again, GI, autoimmune, cardiometabolic, behavioral health, reproductive health, and hormone works really well because what those conditions have in common is that most of them are, or many of them, are highly modifiable, if not reversible, through this root cause approach. And the other reason it works is that, you know, as a doctor, I'm an internal medicine trained. I've never seen a patient who has one thing. The person with IBS or IBD has anxiety. The person trying to get pregnant has high blood sugar and hypertension. The person in menopause has, needs cancer screenings and has depression and so on and so forth. And so by treating a number of comorbidities in one place, Parsley shown through independent actuarial analysis, independently validated data, looking at a 20,000 patient data set, has been shown to drive a 32% reduction in medical spend, as well as significant symptom reduction and a 90 NPS. So we're working with patients across the country. We work through health plans. We have over 10 million covered lives through health plan contracts. We work with self-insured employers. We're working on today our first value-based contracting as well, which is really exciting to move into the value stream, because Matt Holt taught me many years ago that value-based care would eventually get here. And
I've given up on that thought. I was wrong, but
and we also work with the individual market. We're one of the top consumer brands in health and wellness. Follow us on Instagram, get to know us, but we're an educational platform for millions as well.
Fantastic. How many patients are there in the system at the moment? You mentioned 10 million covered lives. How many are you?
I don't share it exactly publicly, but tens of thousands.
All right, fantastic. Because I remember when it was you in one office in New York. So let's talk about that, because you guys have all gone through some transformation there, especially Oshi and Parsley. So I'll start with you, Robin, as we'll go the opposite way. You started as a physical. Go back to we're in the next gen telehealth section here of the awards. You started as a physical clinic, and then what is the state of the art now, and what was the transformation? What happened that made that transformation to telehealth, and what are you able to do in telehealth that you couldn't do before, and what can you not do?
My perspective is even back to my training at Columbia and Mount Sinai was that telehealth was the future, but also telehealth is a feature, not a product. And ultimately, what is it that you're delivering via telehealth? And that makes your care higher quality and higher impact. But that, if you could FaceTime your mom, you should be able to FaceTime your doctor. And so even when we started with our brick and mortar clinics in New York and LA, we were always a hybrid for telehealth between, our patients would come in for that first visit. And then we saw everyone was doing telehealth. And then we saw people were traveling from other cities, states, and countries to access this form of root cause medicine, doing the first visit in person and continuing virtually. This is all before COVID. And so we said, well, this is dumb. Why are we making people drive and fly here? If we can operationalize this broad beyond these clinics, we really should. We're already doing 60% of our care via telehealth. And so we expanded first to 8 states, and then subsequently to 50 states. And I think the biggest thing when you're a telehealth provider is understanding what you can and what you can't do. I really love that you said that. You have to understand when it is that you need to refer into your either primary care or specialty care community, get to that last mile, urgent care on the ground, ER. And because we are a doctor-led program with board certified providers and can refer, we not only manage these patients ourselves, we're also able to steer back into that brick and mortar ecosystem. We don't do procedures, but we do everything else. And then we rely on our amazing proceduralists and specialist community on the ground.
Brilliant. And the management of that, I'm sure, is a big key part of why people pay you. Ryan, tell us same sort of idea. What's the mix between? So I don't think you guys ever pivoted so much, but tell us the mix between the telehealth. What special you can do in telehealth, and where does it really stop? And I would say I was diagnosed with a back joint disorder on a telehealth visit, so you can do quite a lot in telehealth with back pain.
Yeah, no, I appreciate the question. When we first started, we're still young. We're about 3 years old. It was all fee for service because you're a brand new company. Fee for service in terms of the pandemic was, in terms of getting payment of getting people to use telehealth, was certainly a barrier in the beginning. Now that states recognize telehealth, that has made things be a lot easier. Now looking at where we are, about 90% non-fee for service. So case rates, bundles, we're willing to do upside downside population health risk. We've done an attribution model with Milliman on back, neck, hip, knee, shoulder, which is 85% of the spend for most health plans. We're really focused on the non-operative arm. So similar to Robin, we don't do procedures. So people will go through the non-operative physician, physical therapy, both synchronous and asynchronous, potentially some in-person PT. We also have a preoperative optimization arm. We end up sending about 2.5% of our patients on to the surgical arm, which is about a magnitude lower than what you find in the traditional PCP market. And then we also can do postoperative care. So we do refer people on for injections or surgery, or partner with the centers of excellence for the surgical arm. And so mixing those two modalities. And then we also do a lot of shared decision-making. What I mean by that, most of the orthopedic surgeries or spine surgeries are really quality of life operations. Nobody talks about them that way. And the analogy that I'll use here would be, nobody needs a facelift. Facelift is a personal decision if your wrinkles bother you. Nobody needs surgery for pain. And having those conversations with individuals about what's best to get you to your next step is very powerful, regardless of what the imaging shows.
And is there, you mentioned on the physical therapy, the sort of the body tracking technology and other software that you use. How much of this is sort of asynchronous / self-service / automated / versus like an in-person conversation? Sounds like shared decision making is a conversation, but how much, how on the scalability side of that, how much, which is which in your system at the moment, and where do you think you're going?
Yeah, it's a great question. It's heavily towards the synchronous side. Reason for that is, as a medical practice, we have about 40% of our patients are more on the chronic pain side, which requires a medical doctor plus a physical therapist for a functional diagnosis. Having that physician there is very powerful. There's a lot of fake news, for lack of a better word, in the musculoskeletal space of like, I need a surgery, I need an image, my neighbor just had a knee replacement, Dr. Google told me I need this. And so having that integrated care team can help guide people and just manage expectations. and then also do their shared decision making. On the acute side, people sometimes will just do 4 visits synchronously and the rest will be asynchronous, particularly those who are more educated. On the chronic pain side, sometimes it's 30 plus synchronous visits because it's just those people can sometimes be addicted to opiates, failed back surgery, a much more complicated type patient than you would get better with only physical therapy or only a physician. And so it's, the gamut is pretty wide depending on if it's a chronic person compared to brand new pain.
Yeah, I've heard that's the complexity of the patient is a big deal, and the holisticness of the care. I've heard of that, obviously, that both from you and from and Robin. Sam, tell us a bit about the Oshi's got 2 sides of this, right? You have synchronous and asynchronous. Tell us a bit about the mix and how the patient experience is there, and then I'm going to come back to you about money and competitions. We'll go back the other way. Sure.
Yeah, we deliver all of our care virtually, and similar to Robin, if someone needs a procedure, which is GI as a specialty, does a lot of colonoscopy and endoscopy, some diagnostic, some screening for colorectal cancer. They do infusions if someone has inflammatory bowel disease and needs a biologic. It's hard for them to deliver multidisciplinary care. They typically don't staff a GI specialized dietitian or behavioral provider. They often don't know one that lives within 100 miles of wherever they are. And so telehealth's really powerful to connect supply and demand. So we can take a dietitian who's GI specialized, only sees people and delivers GI dietary interventions over and over and over, who lives in a different state, and connect them with a patient in another state, licensed in that state, obviously. And same with the behavioral health side. The gut-brain psychological interventions are very specialized, and it's hard to find providers. So we're able to connect the patient and the provider to deliver that care, to have this high frequency of touch points. A majority of our visits, like Ryan, are also synchronous live telehealth-based visits. And then we will use digital therapeutic tools and content to reinforce what was covered in that visit. So to help sort of have someone, in an asynchronous environment, be able to reinforce what they learned in that session and continue going. Yeah, we've been scaling this across the country now. And again, the cross-state licensure is really what enables us to bring a multidisciplinary care team to somebody. And then we have care coordinators. So when someone does need an in-person service, we navigate their network. We make sure they're getting it in the appropriate site of care. And we'll really take a high-touch role, scheduling that appointment, calling the local provider to explain what we've already done, so no repeat workups get done, and then coordinating to make sure we get the records back and continue serving that patient, either together with the local provider for things like IBD, or standalone if it's just dietary and behavioral, which they often don't have access to.
All right, last set of questions. I'm going to go run the opposite order. They're all going to be different. So, Sam, start with you. How do you get paid? How do you get onto? How do you convince whoever is paying that this is different enough and better than what's been happening before?
Yeah, our clinical trial has really helped confirm that there is cost savings here. It showed significant reductions in repeat endoscopy, in escalations that land people in the emergency room, in the imaging that happens in those scenarios. So all of those drive really significant cost reduction, which has helped us now get coverage by health plans. They typically don't reimburse dietary and behavioral interventions fee for service. So we use a bundled case rate approach. So for every patient, we have a negotiated amount that we can get paid as someone progresses through the care model. And so we've got that in place now with national and regional payers, and then some direct relationships with employers who sponsor the care for their populations.
All right, so it's the payers will pay, put people on the system as long as they think this is saving money. Ryan, slightly different question for you. It's well established, I think, by now that there's a lot of savings to be had in MSK across the board. You mentioned back surgery, avoiding that. We know that not only that several navigator companies have been pushing that for many years. You guys are relatively new. You said 3 years old. There are a couple of companies in your several companies in your space, including a couple that raised hundreds of millions of dollars. How do you explain to people that you're different?
That's a great question. Of those that you're mentioning, they are virtual physical therapy practices. We are a medical practice, so we employ physicians and physical therapists. We're a true care team. In our viewpoint, they have digitized only physical therapy, which is necessary but insufficient. Having physicians only would also be necessary but insufficient. So you need both. We're really a care model play. So the thesis is the care model is broken. I'll be the first to admit, as a board certified spine surgeon, I have no formal training in the non-operative conservative arm. So what's not well known by the public and a lot of primary care providers is when you refer to ortho, you usually see a surgeon who's not well trained in the non-operative arm. So at large, we use, and the status quo, we use the wrong physician specialist to triage, including in the centers of excellence. And so our workhorse is who's the corollary to the cardiologist? It's physical medicine, rehabilitation, non-operative sports medicine, plus a physical therapist. If you send all your patients with chest pain to a heart surgeon, don't be surprised that there are more procedures. And so first is using that right type of care team at the right time, and then making sure that you do a non-fee-for-service model. So similar to Sam, we're in bundled payments or case rates, particularly with rising medical inflation. A huge barrier to any type of care is a copay or anything out of pocket. $30 to the average American is a lot of money.
Yeah, I think, Ryan, you've definitely been kicked out of you've had your, cool surgeon's card stripped out by your buddies in the spine surgery community.
They think I'm crazy.
They've thrown you out of the club. Absolutely. I was always told by my old mentor, Bob Evans, a great health economist, said that a good surgeon will operate on anybody who'll lie down for a few minutes.
Yeah, that's the name of the game. If you have a pulse, we'll operate on you.
Robin, somewhat different question for you. So you're a primary care group, essentially, and there are a gazillion primary care groups and all kinds of solutions for this. And, you think that, and we now are seeing huge companies get into the business of buying primary care groups, and Optum and CVS and everybody else. And you'd think there'd be a ton of competition for this. So how does Parsley, when you go to an employer or a health plan, how does Parsley stand out? You're doing something very different, but how do you explain it? How do you service that?
I think what's really nice about Parsley is that we can be the PCP, and therefore we can close gaps in care. We often find that up to 50% of people, whether or not they're on an attributed list somewhere or not, don't have a PCP, don't actually have primary care. And so we close that gap. We're fully supported to be a virtual PCP. At the same time, for the most part, we are a specialized medical program. I think much like in some ways Vori and Oshi, that wraps the PCP and also wraps the specialist and sits as a layer in between. As we know, our PCPs, there's a shortage of them. We don't train enough of them. They're overwhelmed. And guess what? In 15-minute visits, there's only so much you can do for some of these more complex chronic patients that we typically take care of. In addition, our patient population tends to swamp their offices, reducing their reach. So we really come in for the plans and often for the employers, especially as a force multiplier for the PCPs they have in place, but can then work with those patients, refer them back into brick and mortar PCP as is necessary, not interrupt attribution if we don't need to. We don't need to compete with the PCP. We can actually help them. And then in addition to that, sort of in the other direction, same goes for the specialists. We reduce unnecessary specialist utilization by 77%. So we meaningfully reduce the number of specialists because this population is not just seeing one specialist. They're seeing GI, rheum, derm, psych, MSK, and they've got a PCP. And so we significantly reduce that, but then we can also steer to the high-performing networks of specialists that exist when we need them. And so when you add Parsley in as a layer between PCP and specialty, we can reduce total cost of care in the system. We also significantly, for the plans and especially, again, the employers, reduce the number of point solutions that they need because we can reduce those point solutions by treating more than one comorbidity at once.
Brilliant. Somebody taught you very well, and it wasn't me. Fantastic explanation. So I think so that we're at the end of our time here. This has been the Next-Gen Telehealth. We are missing from the best in class the folks at TytoCare. Fortunately, they couldn't stay on for the second part of this session here. A bit of a screw up there in our communications, but they are the company which you may know, which has the little device which gets sent home and provides and allows people. It's a real telehealth technology. You can stick it in your nose, stick it in your mouth, stick it on your chest. It'll do a lot of measurement, and it sends video and audio and what have you back to the providers. And so they've been growing pretty rapidly, just closed another round. So if you're judging, please don't ignore them. But you just heard from Oshi, Vori Care, and Parsley Health, three really innovative companies. And I think the answer to the very first question about innovation in telehealth is that You can do a hell of a lot with telehealth. You can do a lot virtually. You can do a lot asynchronously and synchronously. And really, we've got to reimagine how we're delivering care. And wouldn't it be nice if you people could drag the rest of the healthcare system along with you? That's my little hope as to maybe where we're going. I'm not sure we're getting to value-based care, Robin, but maybe we're getting to some better examples of what we should be doing with the money we are spending. Anyway. So that is that. That was the Next-Gen Telehealth section. You will see the awards given on the stage. One of these 4 will be the winners of the best in class. 3 of the previous rising stars will also be winners. You'll see them on the moon stage on the health floor at 9 o'clock on 5 o'clock on October the 9th. And so we look forward to seeing you there. Thanks everyone for watching. For the people who are on the video watching now, this will be cut down and sliced up, and there'll be a version of it for the judges to see. If you are judging, please get your judging in soon, because this is being awarded in 10 days. And I think judging closes in the middle of next week. You'll get lots of nasty grams from Melissa at the Digital Health Hub about that. All right, Ariel, you get to shut us down.
All right. Thank you so much for your time, everybody. We encourage you to post on social media and encourage attendance at the grand finale so everybody can celebrate you all. Thank you so much, and we'll see you soon.
Thank you so much.
Hello, I'm Dr. Robin Berzin, and I'm the founder and CEO of Parsley Health, where we make complex care simple. Parsley Health is a specialized virtual clinic that helps complex patients get better and feel better faster using root cause medicine. We're a virtual clinic available nationwide, and independent data shows that we help move populations down the curve from chronic and unstable to stable and healthy, driving a 32% reduction in total cost of care. We hear all the time that healthcare is ever more costly, and yet patients are just getting sicker and sicker. The truth is, it doesn't have to be that way, and that's why I started Parsley Health. Today, 30% of our workforce has a chronic condition or high-cost health complexity, and this group is driving 75% of rising costs. But in our system, they are faced with a revolving door between overworked PCPs and long waits for specialists, while they often fall through the cracks. The reality is, in fact, many of these conditions are modifiable or reversible through treating the root cause. Parsley Health is tackling the rising tide of chronic disease with personalized root cause medicine that puts nutrition, lifestyle, and advanced diagnostic testing on the prescription pad next to medication, leading to transformative results for patients and for our system. How do we do it? Our unique evidence-based methodology starts with a health risk assessment that looks at the whole person, including the social determinants of health, an expanded clinical history, and more targeted diagnostic testing that connects the dots across the body. Our superpower is that we simplify complex healthcare needs by treating the root cause of symptoms to help people get better and feel better. To date, we've treated tens of thousands of patients, and our results speak for themselves. Independently validated data shows that Parsley Health members see a 32% reduction in total medical expenses post-year 2, resulting in a 2x ROI. These patients use 65% less chronic prescription medications and see 77% fewer specialists. Most importantly, they feel better, with 80% reducing or eliminating symptoms in year 1. Parsley Health should win because our mission is to transform the health of everyone everywhere through the world's best possible medicine, and we are on our way. We have impressive traction in working with some of the nation's largest employers and health brands, and are now available in for over 15 million covered lives.
Hello, I'm Dr. Ryan Grant, CEO and founder of Vori Health. Vori is an award-winning, nationwide specialty medical practice designed to treat back and joint pain more effectively. It's no secret musculoskeletal and orthopedic care costs are out of control. They're one of the top costs for health plans and employers. And as a spine neurosurgeon, along with my co-founder, the former chair of orthopedics at the Mayo Clinic, we've seen the root of the problem firsthand. We saw the status quo result in patients suffering from the wrong diagnosis, ineffective treatments, and unnecessary surgeries. The sad truth is that right now, 50%, yes, half, of all people who are getting surgery for back pain don't actually need it. They're going to the operating room, taking on all the surgical risks that come with it to feed a bottom line. We decided there had to be a better way, so we built one. Our superpower and our secret sauce is how we practice medicine. We make it easy for people with back or joint pain to get the right care at the right time. When people sign up with Vori, they get access to medical doctors who specialize in non-surgical care, plus physical therapists, nutritionists, and health coach navigators, a true care team. We look at every aspect of a person's pain holistically through a patient-centric lens that is supported by the right care team. We make surgery absolutely the last resort. At the end of the day, Vori is different. Our virtual first front door makes it as easy as possible for people in pain, no matter where they live, to get care that always puts patients first through an integrated, evidence-based physician-led care model. Vori Health should win because we solve a problem at its root. And when you do that, you get better outcomes. We are actually fixing the broken care model. Our patient-centered approach is proven to lower pain, reduce unnecessary surgery, and lower costs with up to a 4-to-1 return on investment. We built the nation's largest hybrid network for musculoskeletal care, and we're 3 times more effective at reducing unnecessary surgery and achieving savings than our competition. When it comes to muscle and joint pain, there is certainly a better way, and that way is Vori Health. Thank you so much.
Hello, my name is Ohad Polak and I am the Chief Marketing Officer of TytoCare. TytoCare is a virtual healthcare company that enables leading health plans and providers deliver remote healthcare to the whole family through our home smart clinic. The telehealth industry has existed for over 20 years, but suffers from some very basic challenges. There is a limit to what you can do when you are only working with video and audio. Uptake is low, with utilization somewhere around 5 to 10%. This is where TytoCare is really making difference with our home smart clinic. It's designed for families to use and to become the core solution for every household when they need medical care. It allows you to run full remote physical exams, whether it's an urgent care visit or scheduled primary care visit, or even dealing with chronic conditions like asthma. We can treat most medical situations and care modalities from the comfort of home. And we are seeing 5 to 8 times higher utilization than traditional telehealth. We are seeing behavior change in patients using TytoCare, where it's becoming the first line of care. TytoCare's machine learning capabilities makes what we do really unique. We're dealing with collection of very unique information, heart sounds, video of ears and throats. We are able to harvest anonymous data, which we are using to build insights and alerts into our system and provide clinicians with decision support tools that gives PCPs specialist level insights into the exams their patients are running. Today, we support just over 900,000 patients. We are active in 30 countries. We are going to continue expanding condition monitoring capabilities, and we know that this will only grow the impact that TytoCare is having on healthcare industry and on families across.
I'm Sam Holliday, co-founder and CEO of Oshi Health. We're transforming access, outcomes, and the economics for people suffering from digestive health, people like my mom and my sister, and 25% of the US population that lives with these conditions. It's become a top 4 cost category for employers and health plans. That's finally, the stigma is lifting, the picture of cost is becoming more clear, and purchasers are starting to address this category. The current fee-for-service system is really optimized around diagnostic testing, colonoscopy, endoscopy, and imaging to tell people what they do or don't have, and then medications as the primary intervention. But that fails to identify the root cause of what's triggering symptoms and use proven dietary and gut-brain psychology interventions to get those symptoms controlled. This care is generating 29% satisfaction because we're not solving the patient's problem. There are long wait times to CGI, leading to 40% of patients ending up in the ER as symptoms escalate and driving very high cost. So our solution is a virtual first integrated GI clinic, multidisciplinary, including the dietary and behavioral health providers, along with GI doctors and nurse practitioners, to deliver whole person care that gets to the root cause and implements dietary and gut-brain changes, all based on evidence and with a value-based approach. We can treat and diagnose any GI condition, anything shown here that 25% of the population live with. And we do that in a hybrid collaborative model, working to optimize the local providers and what they're really set up to do, the colonoscopy, endoscopy, and visits, and take off their plate the between visit care, the high touch dietary and psychological interventions that often aren't even reimbursed. And that's really our job, is to fight for that reimbursement. We've proven this in a gold standard clinical trial that our CMO presented yesterday here at ATA that showed 91% of members getting symptom control within 4 months, leading to really high satisfaction and improvements in workplace productivity, quality of life, and reduction in stress and anxiety. And importantly for purchasers, leading to $7,000 of GI-specific savings, $11,000 of all cause in 9 months by avoiding unnecessary procedures, imaging, ER visits, and medication use.
Hi, my name is Puneet Singh, and I serve as CEO of CareBridge. To give you some background on CareBridge and our solution, we serve patients with physical, intellectual, and developmental disabilities who are receiving home and community-based services from Medicaid. We provide patients, their families, and their caregivers 24/7 access to an interdisciplinary clinical team of physicians, nurse practitioners, pharmacists, and social workers. We help assist issues ranging from acute exacerbations to social determinants of health. And we also offer a decision support solution where our clinical team, including physical and occupational therapists, help ensure patients have the resources they need to maximize their independence and safety at home, including durable medical equipment ranging from shower chairs to electronic pillboxes. What makes us stand out, and our superpower, is our focus on a very vulnerable population. While individuals receiving home and community-based services only represent 3% of Medicaid membership, they represent 17% of total Medicaid spend. We are the only company in the country with a value-based care solution created to address both the medical and HCBS needs of this population. This focus has shown that we can drive unique results in the market, including reducing inpatient admissions by over 20% and HCBS costs by 10%, while increasing patient independence and quality of care. I couldn't be more excited and honored that CareBridge is a quarterfinalist and potential winner for the 2023 Digital Health Hub Rising Star Award, a true reflection of the hard work of our teammates and colleagues who spend every day helping patients in need.
Physical therapy is a powerful service to drive recovery and improve outcomes. Historically, access to your expert care was limited to in-person visits only, but not anymore. Introducing IncludeHealth, a next-generation digital platform that extends, not replaces, your in-person care into patients' homes. Our HIPAA-compliant and FDA-registered platform was meticulously built to provide a secure and seamless connection between you and your patient, regardless of location. Powered by the latest in computer vision, our platform delivers interactive home exercises and remote monitoring directly through your patient's own devices. Compatible with patients' phones, tablets, and laptops, we provide interactive exercises with objective data collection to measure patient progress and help them achieve their recovery goals. No sensors, downloads, or passwords required. To start, our digital plan builder lets you create tailored plans specific to your patient's needs. Choose from a library of pre-built templates or build custom plans with a wide variety of exercises, functional tests, and surveys. Once saved, a text or email is automatically sent to your patient with a link to access their plan. To begin, patients click the link and their care plan is instantly accessed via their web browser. Their plan is then delivered step by step with real-time feedback, helping them progress on their road to recovery. Once complete, a report is automatically generated with objective data and analytics for your review. You can review your patient's adherence and outcomes from a single session, or track their progress over time. Adjustments to their plan can then be easily made based on their performance to help maximize their recovery. As a powerful extension of your in-person care, our platform can be utilized in remote therapeutic monitoring, value-based care, or even in direct-to-consumer initiatives. Most importantly, your patients now have access to your care anytime, anywhere on their road to recovery. IncludeHealth, extending your care beyond the clinic.
Chronic pain affects 100 million people in the US. In addition to sheer suffering, chronic pain causes multiple comorbidities, from increased cancer and cardiac risks to the problems of opioid addiction. In 1992, I had a severe spinal injury which caused nerve damage pain that was so severe I was given a 5-year life expectancy. I tried all of the standard treatments for chronic pain and nothing worked. So I developed Sana, which in just 3 months totally wiped out my underlying pain and saved my life. The device works by using pulsed light and sound and a heart rate variability feedback loop, which guides the user into a deep state of relaxation, which reduces pain and improves sleep. We have just completed a 75-person study, which showed a 3 times reduction in pain against placebo in just 10 minutes. We are now gearing up for clinical trials with Mount Sinai and the Texas Medical Center to take us through FDA and out to the market.
We are really excited to be running the clinical trial with Sana Health to look at the way that Sana can help our patients with neuropathic pain. This is an incredibly debilitating condition that is a huge issue. It really affects quality of life in all of our patients. We're really excited about this technology because we believe it could be truly disruptive in the way that we treat and think about chronic pain.
Here is Hattie, one of our earliest users.
It made my skin feel like it was normal again, and it made the pain go down.
If you are interested in helping us help millions of people like Hattie, I look forward to hearing from you.
Hi everyone, my name is Sebastian Seiguer. I'm the CEO of Singh Health. We were formerly called Emoca and recently rebranded. Thank you so much for having us as a quarter finalist this year. At Singh Health, we help people take their medication properly and consistently. We do that using video technology. Patients video record themselves taking their medication, telling us how they feel. They really tell us a lot about how they feel. And on the other end, our virtual care team of pharmacists, nurses, and health coaches review each video and record a video and send it right back to the patient. This is essentially an asynchronous video appointment. Our superpower is that what we do actually works. That cannot be taken for granted in digital health. We have 20 peer-reviewed publications showing that we help people in various conditions achieve very high rates of medication adherence. That includes methadone for opioid use disorders, asthma, hypertension, diabetes, HIV, hepatitis C, tuberculosis. Across conditions, what we do helps people take their medication properly. Why should we win? Well, it's been a breakthrough year for the company. In March, the CDC recommended what Singh Health does as the standard of care for supporting medication adherence in infectious diseases. So the fact is that it's been the first time ever in digital health that an asynchronous video appointment has been deemed equivalent to an in-person appointment between a patient and a provider. Thank you so much and see you at the event.
Hi, I'm Matt Haston, CEO of Motto. Motto is a tech-enabled rheumatology clinic that provides transformative, integrative care for patients while drastically reducing the usage of high-cost biologic drugs. Patients love us for the access and time they get with our full care team, and risk-bearing organizations love us for the cost savings that Motto creates while delivering phenomenal patient care. Our superpower is combining both patient-provided and clinical data into our integrative care model to deliver a personalized care plan for every single Motto patient. Motto patients are living every single day with chronic conditions that can flare at a moment's notice. That in a traditional rheumatology practice, patients are left alone in their moment of need. Motto patients interact with their health coach 8 times on average per month. That creates an incredibly tight feedback loop between patient, health coach, and doctor that lets Motto quickly adapt to our patients' changing needs in real time. We're able to achieve these outcomes because of the incredibly tight coupling between our care team and our Motto platform. Motto should win the Rising Stars Next-Gen Telemedicine Award because of our patients and the results that they have been able to achieve while working with Motto. In our year of seeing patients, we've been able to impact the treatment of half of our patients within 6 months of joining our program, all while delivering a level of care and collaboration that our patients tell us is unlike anything else they've experienced in a specialist setting. Our results are great for patients, but they are truly transformative for risk-bearing organizations. Motto saves those organizations on average $7,800 per patient in year 1. We're honored to be nominated among such a strong group of innovative companies, and we look forward to seeing you at Health.
Hello, I'm Dr. Sheela Myers, Chief Medical Officer of Neuroglee and a practicing neurologist. I joined Neuroglee because I firmly believe in our vision to reimagine whole person cognitive care. As we age, brain health issues like cognitive impairment and dementia become more prevalent, and yet a clear treatment path remains elusive when patients experience early symptoms. As a result, many patients fail to seek needed care until symptoms have progressed, impacting their safety, independence, and limiting the window for effective intervention. For many physicians, treating cognitive decline often takes a back seat to managing more directly addressable medical concerns. Neuroglee is leaning in to fundamentally transform the status quo, operating as the virtual extension for medical groups, providing additional expert resources to manage cognitive care. Our partners gain immediate access to our team of multidisciplinary specialists, an engaging patient app, and powerful analytical tools, which, when combined, help improve cognition, quality of life, and prolong patient independence. In fact, our data shows that our virtual home-based approach leads to better patient and caregiver experiences and outcomes, including a 70% improvement in overall memory, 68% increase in overall cognition, and over a 30% decrease in comorbid symptoms of depression, anxiety, and stress. Our clinical teams seamlessly integrate with our partners to streamline operations, beginning with stratifying and enrolling patients, developing personalized cognitive care plans, and fostering patient and caregiver engagement throughout their clinical journey. We're excited to be at the forefront of reimagining whole person cognitive care and helping our partners set a new standard for the patient, caregiver, and provider experience.
My name is Amanda Gorman. I'm a pediatric nurse practitioner and founded Nest Collaborative to expand access to evidence-based breastfeeding support for women. Health systems today are doing an excellent job at promoting breastfeeding, and we're seeing the highest initiation rates in history. 80% of US moms are trying to breastfeed. Unfortunately, 70% fail and aren't able to meet just the minimum feeding recommendations to breastfeed exclusively for 6 months. We're using technology to provide a platform where mom has quicker and faster early access to supports, closing the shortage gap. Today there's a national shortage of lactation providers, and most women don't have access to support resources through their pediatric or obstetric providers. So we're offering an option for those women to reach us through their phone, tablet, or computer. They see a live IBCLC, an international board certified lactation consultant, whether they're looking for answers to questions prenatally for preparation or during the first few days at home when it's really difficult to get out of the house and back to the hospital, or down the road when she's preparing to go back to work, pump and store her milk for her baby. Through our online video visits, women can see a live IBCLC, and it's typically covered by their health plan.
Imagine for a second that you're not living in the Bay Area with access to best health services one can receive. Billions of people, including people in our own rural areas, have limited access to healthcare due to a global shortage of physicians and nurses. This leads to inequity in care and healthcare professional burnouts. Referring patients to larger centers is not only costly, but delays the time to clinical decision making, which leads to poorer patient outcomes. Inadequate telemedicine tools such as handheld devices and video stations do not allow for a comprehensive assessment of the patient nor any interaction between the two clinicians. In addition, hand and eye coordination using handheld devices is quite difficult. And if you were to achieve optimal results, you would need a second person pointing the handheld device to the area of interest, which in itself is inefficient due to the shortages of physician and nurses already in place. Using our technology, the frontline clinician has instant access to remote experts' knowledge with the confidence of over-the-shoulder guidance using augmented reality enhanced by artificial intelligence. Our platform has been designed with over 30 years of experience in healthcare and medtech settings. Our connected ecosystem improves access to care by eliminating geographical barriers and bringing care closer to home. Ultimately, the burden on the healthcare system is reduced while improving quality and equity in care. Quite simply, we bring a highly advanced and clinically meaningful solution to solve for the three biggest challenges in healthcare: time, resources, and patient outcome. We believe in changing virtual care from a video solution to a connected and intelligent platform where patients and health providers are empowered and actively engaged.